Good morning, students. Today we will see about the primary health care. Primary health care is the class Purnima madam also has taken, but some newcomers did not attend her class, and I have added some few more points about the primary health care. So, primary health care is a very important question. Without primary health care, we cannot achieve the goals. So, if I want to say about the common things about the primary health care is a very essential health care. This health care every country is formulating according to their budget, and all our health programs are passing through the primary health care. Whatever the program, national like communicable disease control program or non-communicable disease control program, or any other program by the state government or central government, Indradhanush Yojana or anything programs will be reaching through, passing through the people through the primary health care. So the community health nurse must learn about what is the primary health care. In this chapter, we are going to learn about what is the definition of primary health care, what is the history of primary health care, who is the father of primary health care, what is the principles of primary health care, what is the elements and functions, what is 4 A's and 4 E's of primary health care, what is the current trend in primary health care. First thing, you have to understand the concept of the primary health care. So I told you, make you to understand what is the primary health care. So primary health care only every country having under the supervision of WHO. The primary health care services are rendered either the primary level or tertiary level according to the budget made by the India government, any government, how much they are allotting from their GDP, whatever it may be. Understand? So if you first see the history, first, though in the board committee they have made the primary health care concept, it came from the board committee. The first 3 primary health care center were present in 1952 in Delhi, and Singur in West Bengal, and Poonamalli from Tamil Nadu district. So this is the first primary health care center being started. Who is the father of primary health care? Professor Ransom Kuti. Ransom Kuti is the father of the primary health care. Let us see the definition of primary health care. What is the definition of any definition or the primary health care? You have to remember some key words you remember. You can easily remember your definition. So primary healthcare is a healthcare universally accessible, acceptable to the people, to the individual and the family and the community, and with the cost with the country or the community can afford it. Understand? So that is called primary healthcare. So what is the thing I told you? I told about it is a universal healthcare, universally accessible, acceptable by the people, and the cost, individual, family and community, with the cost, country, affordable. Okay, so these keywords you remember, you can formulate your own definition. So it is a universal healthcare, universally accessible, acceptable to the people, to the individual, family and the community, with the cost which a country can afford it. So affordability is coming. So it's acceptable, affordable, how much I can afford it. So now I am telling to Sri Lanka to how Sri Lanka is very very difficult. They are not even getting the basic drugs. So though the system is very good, now the system is getting collapsed. So even the primary healthcare is affected, and the poor people. So the healthcare delivery system itself going to getting affected. Okay. What is the next one is the principles of primary healthcare. What is the principles? The main principle is first one's equitable distribution, intersectoral coordination, then community participation, then appropriate technology, then will be manpower development. Understand? So what is called equitable distribution? Without any caste or greed or anybody through anyone coming to the primary healthcare center, they get the equal healthcare services. So intersectoral coordination. Health is not only the responsibility of the healthcare. So the health also depend upon the other sector like a sanitation, water supply, like any department, educational department. So education department should give the awareness to the school children to prevent. So everything, it is a intersectoral coordination. So the community participation, it's very very important. You go and only give service to the people, they will not, unless until you make them to participate, make them to come. You have to bridge the gap. So this bridging the gap we are doing, we have bridged the gap. The primary healthcare service is very very good in a South India. If you take North India, the community participation is very poor. So what they have done in the NRHM scheme, they made some of the schemes. They under NRHM, they created the cadre called ASHA, USHA. So the own people, own community, their own community people ASHA been selected. So she will give, she will be giving awareness. So once they give awareness, so this awareness create the interest. So interest will help them to participate. So the gap will be reduced and the healthcare will be reached to the poorer people. Then will be appropriate technology. So appropriate technology, you have very very important. This technology, appropriate technology should be appropriate and economical and acceptable by all the people. That's what one example I told in the class. For example, I have developed one abscess. Some of the country, they are giving a leech therapy. So leech therapy, it is okay, appropriate for them. Whether it is acceptable by the WHO, everybody will accept that? No. Isn't it? So you have to develop some technology. That technology should be effective and it should be accessible. It should be acceptable by the people. Though only you will get the cooperation. Understand? Then the another principle is the manpower development. The manpower development is very important. Rather building a new primary healthcare center and there is no doctor and nurses, it is very important to develop the manpower development. I will tell you how the government has implemented the manpower development. In the end, in the trend, I will tell how these manpower development been implemented, we will see. So I hope now you understood about what is the principles of primary health care. It is a equitable distribution, intersectoral coordination, community participation, appropriate technology, manpower development. Okay, next we can see about the elements. Okay, elements you can write ELEMENTS, elements. So these are all the concept you remember. You no need to mug up. This is called the concept based learning. Every subject you can develop your own concept. What is E? First one you can do the education. Education. That's why I told you, when you educate, Asha or Usha are going to educate the community people, though that education going to create the awareness. So this is called education. L. This one is the local endemic disease control. Endemic disease control. Local endemic disease control. You know what is endemic, what is epidemic, what is pandemic. Corona is the pandemic. Endemic in a particular area. Sudden outbreak of a disease in a particular area. So you have to primary healthcare center will be controlling through this endemic, this one. And another E, you can remember another mnemonics you can put. It is called EPI. What is EPI? It's nothing but expanded program of immunization. See, immunization, with the immunization only we have controlled lot of diseases. I told you, my father had 7, 8 brothers and sisters. Now only 3 are alive. Now only 2 children and all the children are alive. Why they died? Because they died with a smallpox. Now currently immunization program has very effective after implementing of EPI. So now everybody, all the children die with the smallpox. Now we have eradicated the smallpox. How we have eradicated? Mainly by the EPI program, expanded program of immunization. Then another mnemonics you can write here is MCH. What is this? Maternal and child health. Maternal and child health means everything will be included. Antenatal care, postnatal care, intranatal care, everything is being included. So this MCH, you remember in the trends I will explain what all the changes has come in this one. Okay. Next one is called the E. Another E. This is called the essential drug supply. Essential drug supply. Before and all, it's not like that. Every primary healthcare center, even go to the government hospital, only 3 color tablets will be available. One will be white color, one will be pink color, one will be yellow color. Multivitamin tablet, and one will be vitamin. Some B complex tablet will be in yellow color. So all the disease we will be getting. I am talking about when I was very small girl. Okay, now currently very essential drugs. It's like it's a client oriented approach. If you go with the diabetic, you will get a diabetic drug. If you go with the hypertension, you will get this. So all the drug supplies we are getting into the primary healthcare center itself. We are getting all the drug supplies. Then what is called? Next one is called the nutrition. Nutrition according to the nutrition, supply of the essential nutrition to the people. Mainly for the, they are concentrating about the pregnant women. If you go, they coordinate with the NGOs, non-governmental organization. They provide the nutritional diet to the pregnant mother. And then next is T is treatment. What is called treatment? Treatment of communicable and non-communicable diseases. They are treating in the primary healthcare level. And S is the safe water supply and sanitation. Understand? So this concept is very good, right? Elements, you can write about elements. The one beautiful thing is with the elements you can write the functions, right? You can write about the functions like health education, one of the function, immunization another function, antenatal care, postnatal care, okay, birth control measures, vaccination, providing the nutrition, sanitation, drug supply, everything is you can write as a function, right? Next we will see about, I wrote something about 4 A's. What is these 4 A's of primary health care? First A is called, in the definition itself we can remember the universal health care. Primary health care is universal health care, universally accessible, acceptable, right? 2 or 3 it is coming, appropriate it's coming. Same thing we are going to write here. So you can write as accessibility, appropriateness, and then affordability. What I told you in the beginning, affordable, with the country or the community can afford, how much I can afford it. Then will be acceptability, how much I can accept it, whether I cannot give leech therapy, it should be acceptable by the people, with the country or community can cost about it. What is called E? I told you about 4E, that is called effectiveness. Understand? First one is effectiveness, efficiency, economic, and is equity. You can write it as a equity. So these are all this 4 A's and 4 E's in the primary healthcare, you can remember. Now we will see about what is called current trends. This current trends, what is the current trends? You can remember about BMOC. What is BMOC? Basic Emergency Obstetric and Newborn Care. Basic emergency obstetric, maternal and obstetric and neonatal care. Okay. So what is called EMOC? EMOC. This is called EMOC. This is emergency obstetric neonatal care. What is called CMOC? CMOC. This is called comprehensive emergency obstetric neonatal care. This is the current trends. I told you, rather building of new primary healthcare center, That is our principle. What is the principles we have seen? Yes, manpower development. Principle we have seen about what is manpower development. So manpower development, when you develop new, you can put an obstetrician, you can put the newborn, many primary healthcare center, you go, even incubator is present, newborn care, suction apparatus, very hi-fi machines, sophisticated equipments are present, and many operation theaters are present. So this is the implementation of CMONG and EMONG in the primary. This is the current trends, and it's 24-hour into 7-hour service. Every time doctors will be available, good referral services available, ambulance services will be available, 108, according to the state the number will be changing. So this is about the current trends in the primary health care. So in this chapter, when this big question is coming, you can write you can write either start with the definition or start with the introduction. You can write something about, you can say what I told you about what is the introduction of this, why the primary healthcare is very important. Primary healthcare, all the programs are going through the community through the primary healthcare only implemented and reaching the people, you can tell. Then you can write the definition of primary healthcare. Primary healthcare is the essential healthcare universally accessible to the individual, family and the community by means of their acceptable to them through their full participation with the cost that the community or country can afford it. Understand? So our GDP, how much I am allotting? Maybe US allotting for 17%, India is allotting for 2.9%, isn't it? So according to that, how much I can able to give. That is why it is the definition. Primary healthcare is the essential healthcare universally acceptable to the individual, family and the community by means of their acceptability to them through their full participation and the cost that the country or the community can afford it. Correct? Then you can write about the history, which year they started, what are all the 3 places mainly will be South and North India they have started, who is the father, Professor Ransom Kuti, and what is the principles of primary healthcare. Primary healthcare 4 principles: equitable distribution, like intersectoral coordination, community participation, appropriate technology and the manpower development. And the elements of primary healthcare, ELEMENTS, you can put education, local endemic disease control, and E is EPI, expanded program of immunization, M is MCH, E is essential drug supply to the people, and then is the nutrition, T is the treatment for communicable and non-communicable diseases, S means safe water supply and the sanitation. Understand? Then with the elements you can write the functions: antenatal, postnatal, immunization, vaccination, survey, home visit, school health program, all the functions you can write, X and Y you can write. Understand? And you can write about 4 years and 4 years and the current trends. Now there will be the question will be asked always by the 2 mark, and you are writing irrelevant answer. That should be avoided. That is mainly by the covering population of the primary healthcare center. When we are asking what is the covering population of the primary healthcare center, many students you are writing like that: child, adult, adolescent, old age. Yes, of course, all are the population, right? The community. So we have to write what is the covering population, urban and rural. If it is a rural, 1:20,000. It's urban, 1:30,000. Understand? What is sub-health center? Sub-health center, rural and urban. What is the covering? 1:5,000 or 1:3,000, urban, rural. So that is how your writing should be there. So you have to remember the concept. So if it is mental concept, you have to remember what is the thing I am going to write about the primary health care, the definition and the principle or the elements, and then what are all this one, right? Elements and the functions. What is the 4 years, not a triple A, the 4 years and 4 years, what are the current trends, B-monk, C-monk, E-monk. So what is this monk, why we are doing? So in the beginning itself I told you manpower development. The manpower development itself putting all the specialized people in the primary healthcare center. So we are upgrading. On the primary healthcare is a block primary healthcare center. So block primary healthcare center bed ratio also can be increased. So we cover the more population. Understand? So this is a very very important question, always asked question by the university. Whatever the university may be, they will be really asking for the GNM or the BSc or the MSc. So you understand the concept and write by your own words. You will get the good mark, and add some of the current trends: 24-hour into 7-hour service and referral services, 108 ambulances and other thing. So empowering the primary level staff also, Asha, Usha, all these things will be empowering, and link services, filling the gap between this. So this is about the primary healthcare. Hope you all will be writing very well and get the full mark. Thank you.